Hello, I'm here with Susan Wells with Wells Plastic Surgery and Skincare. She's a skincare specialist, and we are going to go over Dysport. It is now the leading Botox alternative, and I'd like for her to talk a little bit more about that, and then we'll also do some injections today. Susan?
Good. Well, Jen and I have already talked a little bit about what her goals are, and Jen reports that she has had Botox in the past. She had a good result. She has some lasting results, actually, from 4 or 5 months ago, I think. She's interested in treating her forehead, and we've already done a few marks here, so you'll see this. She is going to treat her forehead. She reported that her lines used to be much deeper across here, except raise your eyebrows. It's not as strong here anymore, but she has some really strong lateral muscles here, and that's going to be one of our goals of treatment today. In the glabella or scowl region, or commonly referred to as the 11s, you know, put your brows together. She doesn't have so much movement at all, but we're going to retreat it just a little bit because her goals are not only to get rid of the wrinkles she has, but prevent the formation of future ones. The other thing is that will keep her on track so that she'll be on a regular schedule for all her regions and not having to come in at staggered times. The other place she wants to treat is her crow's feet. And you'll see, smile real big. She has fanning out little lines. Relax. Now, something that she reports is new is what we look for is not only wrinkles when they're active, but what happens to the skin at rest. And you'll see she's getting a few little lines here. And that alerts us that we need to do this not only to correct wrinkles, but for prevention. And what we usually do to get the best result is couple it with a retinoid, something to build collagen, because when that tissue's at rest, those fine creases, the skin will actually rebuild and repair from underneath. So you get more bang for your buck if you couple those two interventions together. And oftentimes people will come in and spend $700 or $800 on neurotoxins, and they're not doing anything at home to repair their skin for another $50. Right. They can have a prescription drug that's got a 3-decade history of efficacy.
And that's a good thing to mention. So even if people are going to go out and get Dysport, they should still be using a regimen at home.
Absolutely.
To take care of the skin and
Absolutely.
I think a lot of people, that is a misconception. I think some people think that it can replace skincare regimens.
Absolutely not. You can get a nice result, but you're really not making the most of your money by doing that. And long term, you know, interventions alone, they're okay, but it all is very complementary. Home care and interventions together, staged correctly and over time. So today what we're going to do is I'm going to show you a couple of the muscles that we're treating and how we typically choose our sites. In the forehead there's a large muscle, and we're not going to go over the Latin names, but what we're basically doing is playing with muscles that elevate, levators, or things that depress, that pull things in. And the forehead's a levator, and it elevates eyebrows. So what we're trying to do is, in a controlled fashion, decrease that ability without changing the position of the eyebrow. Typically, in a really strong person with a large forehead, which you are not, we would do anywhere from 4 to 5 sites in 2 rows. So a total of 8 to 10 little injection sites. You're a very petite person. You have some lingering effects from your former treatment, so we're only going to do 6 sites on you. And we're going to come back in a week or 10 days and kind of see what your result is, and we may do a touch-up. I do that on purpose because I don't want to over-treat the brow, because if you do that, you can drop the position, and that's very undesirable. It's not our goal. Okay, now interestingly, the eye has a big circular muscle around it, and what we do is knock out the muscle right in this region so it doesn't pinch. We don't want to do that elsewhere because we want your eyelids to move. Another place that actually you had a concern is your bunny lines. And you can see when she pulls her nose up, it's right here. We can't always get those totally, but we can put little injections on either side. And there's a real interesting little muscle group that runs down here. And interestingly, when I treat 11s or scowl lines, I always come down a little bit, and not everybody does that. It's a little trick I'll have to give credit to Dr. Wells that he always does when he does his injections. And what it does is it prevents, when you freeze this, it prevents this eyebrow from dropping. I don't know if you've ever seen somebody who's got a real acute angle, but it elevates your medial brow a little bit, so you're fresher and more open. That's a little trick. And I'll tell you, and we didn't mention this, and it's not a need for you, but I can't tell you how many older ladies come in, actually older, 40s and up, that have lots of little lines
My
around
mom
their
had
mouth.
it there.
Did she?
Mm-hmm.
Well, a trick is to do very low dose. We
Right.
just do 4 little sites around each lip, 1 unit each, just a micro dose to decrease the strength of that. And oftentimes we layer 3 interventions with that, put it at rest, get them on Retin-A to start repairing, then come back and maybe do some filler. If you were to just do the filler alone, it would wear off and it wouldn't be as good of an outcome as doing those 3 together. So that's how we stage it. And people have gotten very addicted to this perioral treatment.
I would imagine,
Uh-huh.
yeah.
Now, it does, a caveat is it wears off faster because
it's
you
not
use
as much,
such a low dose.
right.
So they're more like on an 8-week schedule. But the cost is so low. You know, it's like $40 a lip
To have the-
every
yeah.
8 weeks. That's huge to get rid of those
Oh,
wrinkles.
yeah.
Yeah. So, anyway, that's just a little bit about muscle groups we treat. I have already alcoholed and cleansed her skin. I'm going to go on and finish marking her and drop her dose. Stick. Turn towards me. Which I have laid out. You doing okay?
Mm-hmm.
Stick. This is where the numbing medicine really helps. So over here. Is that too bad?
No, gosh, that's the best numbing medicine in the world.
You don't have it on your face for an hour. And it really